Hi, I'm Dr. Srinath Kumar. I'm the Senior Consultant, Head and Group Coordinator for Emergency Services in Narayana Health Bangalore. Why emergency department is very important as a hospital? It is the face of the hospital. Most of the critically ill patients who need the services of the hospital enter into the emergency services. And when they come into emergency, we have to look into three aspects. One is regarding the patient, patient attenders, and communication to the hospital. Patients will come with high emotions, and their diseases range from fever to maybe unconsciousness. And we at Narayana are well equipped to take care of such emergencies. Say it a golden hour or platinum minutes or even in seconds, because every second counts in emergency department. We work as a team in Narayana. We have 7 consultants and we have around 20 residents. We cover the whole day and night services. Apart from giving these services, what else we can do? We pick up the patient from the house, pick up the patient from the roadside, because those are the patients who require our services in that platinum seconds what we speak about. And when they call us, we have to get the information regarding how the patient is and what are the things we have to take care when we go outside the hospital. That is called as pre-hospital services. Let it be a myocardial infarction, stroke, or an unconscious victim or a trauma victim. So we pick them up and bring to the hospital, and in the hospital, we triage them into various zones. Whether this patient requires immediate resuscitation or it can be taken care of a little bit later. So if a patient requires resuscitation, that means that we take care of the airway, breathing, and circulation. What do you think? So what is meant by airway? Airway is nothing but what the patient breathes in and breathes out. If there is any compromise in breathing, we take care of the breathing problems. We look into the oxygen levels and start the oxygen for the patients. And then we look into the pulse and the blood pressure. If they are high or low, we take care of those things. And then if a patient requires an IV line and requiring IV fluids, we start them immediately and look into the illness. Only after doing these things, we communicate to the patient what kind of illness they have, so that gives them a confidence when they come into the hospital, what they are taking care of. The doctor is the most important contact between a patient and the patient attender. So we look into the patient, start the treatment, then take for the history and give them the appropriate care and admit them in various places, whether they require an urgent requirement of the intensive care facility or high dependency unit facility or a general ward facility, or if a patient requires immediate surgery, we ensure that we take care the patient has been ready for the surgery and handed over to the surgeon, and the anesthetist will be taken care of. So that is how there are 3 parts of the emergency services. One is your pre-hospital service, second part is your triaging the patient, and third part is taking care of the patient in the emergency department itself. So this should give you an idea how the emergency department works in, and why all the patients who come in should stay calm, the patient attenders should stay calm, listen to us, what we are doing, look into us, what we are doing. Another specialty is, what we do is, we call the patient attenders whenever we do some emergency care or emergency resuscitation. We show them what we do and then we proceed to do onto the patient. So it gives a confidence to the patient attender that we are on the right track and we are with the right place, and the patient attender should be well confined and they know what the patient is getting done. So this is how the emergency department plays in a very important vital role in the hospital.